So that was about the program. In case of any questions, we will be addressing them towards the end. First, I'd like to proceed with our conversation with Dr. Keerthi Pradhan. I'd just like to introduce him. Um, Dr. Pradhan is an experienced professional in healthcare and has worked in various capacities across the sector. Previously, he was the professor and head of public health and healthcare management program at Chitkara University, Chandigarh. He's currently on the advisory board with the School of Public Health. Thank you so much for joining us, Dr. Pradhan. We're really looking forward to hearing your insights on our questions today.
Thank you. Thank you.
So, to begin with, there's a lot of lack of clarity actually that exists regarding the role that public health professionals play. So, what are the areas that public health professionals are really needed in?
Okay, yeah. So, public health has been a field of study for a long time. It's like hundreds of years we have been hearing about public health, MPH, Masters in Public Health. In India, although it's not so popular, but globally, it has huge credentials. You go to any country, including our neighboring countries like Nepal, Bangladesh, Bhutan, Sri Lanka, there is huge credential of MPH, and which post-COVID, I think India has taken its lead from the government side and from the public health non-government side. They have shown interest in having public health professionals in every field of healthcare ecosystem. So when I say healthcare ecosystem, which comprises of entire range of stakeholders, which means hospitals, pharmaceutical companies, medtech companies, consumable manufacturing companies, international NGOs, consulting companies, literally everybody in that way. Whoever has a contribution to the health sector comes into the entire healthcare ecosystem. And public health professionals are required in all of this, be it a pharma company, be it a hospital, be it a medical technology company, be it a digital health company, be it a consulting company, be it an international NGO, all these, which until COVID came, our public health professionals had not realized. And the traditional thinking was public health means it's meant for research, which is not the truth. The truth is public health professionals can become public health researchers for sure, public health management professionals. And today, with the growing need for digital health, they are about public health informatics professionals, public health consulting professionals, and the entire health and life sciences domain of market research companies, consulting companies, international companies, all that they need public health professional. Typically, the degree is Masters in Public Health.
Okay, so as you mentioned, there are so many specific areas that public health professionals are really needed in. So do you think to do a program in public health, there's something that one needs to do in their bachelor's, or can anyone be part of the public health program? Or does one have to be from the sciences only, or just from the medical background, or any other prerequisites for entering a public health program?
Okay, yeah. So traditionally, there has been a thinking that only medical professionals can enter into public health, which is not the truth. Why? As we all know, health is a factor of multiple subsectors. It's not just medicine or medical professionals. And that's the way we understand when you look at the medical determinants of health, all of us know. Our health is affected, and there is a direct impact of medicine, medical, those factors. But we keep analyzing, you keep hearing about political determinants of health, social determinants of health, and very recently we are hearing about commercial determinants of health. So imagine all these are coming up in a big ways. How the entire political ecosystem affects health and public health, how the entire social ecosystem is affecting health and the entire public health domain, commercial aspects, the business, the private sector, how it has created the pollution, the carbon footprint, how it impacts the health sector, the healthcare, and the pesticides, fertilizer, plastic, air conditioning. I'm sure all of us know all this as way of our common sense. But converting all this into a public health education, which means we just don't need medical professionals. We need all range of people, be it political science, be it economics, be it liberal arts, be it engineering, be it pharmaceutical sciences. So all sectors, including hospitality, because there is a huge amount of nutritional aspects to public health. And in hospitality, the hotel management, the hospitality, the all those areas, they talk about in their studies a lot about nutritional value, food and nutrition and all that. So we need all these kind of graduates to come into masters in public health. So it's not just about a particular qualification. And today's employers, today's organizations who are employing public health professionals, they look for all kind of academic backgrounds at the graduate level to become a good public health professional who has understanding about the political ecosystem, social ecosystem, private ecosystem, humanitarian ecosystem, and entire range of nature, pollution, climate, and the psychological aspects of health. All these all contributes to the entire public health ecosystem. Hence, any graduate with a passion to serve in the area of public health can be the right choice for doing MPH.
Thank you. I think that is one of the main things that a lot of people want to know if they need to have a certain background, uh, ability to be able to enter this program. But public health is about so many aspects, and so we can't really limit it to a particular field. And that is one thing that once we get into the program, you also have these core areas of epidemiology and biostatistics. That's usually why a lot of people equate public health with the sciences. But do you think today there's any scope beyond these fields for specification in the program?
Yes, because the job market demands people with various interests. Although the degree remains the same, which is Masters in Public Health, when I look at the job tracks what the MPS do are very varied, starting with public health management, public health research, public health informatics, or public health digital health space, public health consulting, and the entire range of pharma companies. Traditionally, pharma companies used to take these science graduates to become medical representatives. Today, those era has gone, and today they are looking at health systems analysis. All these pharma companies look for health systems analyst, and a health systems analyst, a public health profession is the right choice, or MPH is the right candidate to become a health systems analyst in a pharma company. They do a lot of statewide, region-wise nationwide health systems analysis to decide what kind of pharmaceutical products can go into the market, what is the need, what is the demand, where is the unmet need and all that. So they need MPH. They don't need just the medical reps. Traditionally, they used to recruit. So similarly, medical technology companies, consumable manufacturing companies, all of them have started recruiting MPH to be the health systems analyst, business analyst they call it, but it's actually health systems analyst. And who can do a better job of health systems analyst? MPH, who has holistic knowledge about the entire healthcare ecosystem and its kind of epidemiology, statistics, analysis, research methods, all these areas. So these are the kind of demands today in the market. It's not just one type of job, but it's a variety of jobs in the entire ecosystem of healthcare.
Right. And there's also the opportunity for students who do a master's in public health to pursue further in academia. Are there any programs that they can pursue after this, or is it just the job market that awaits them?
See, that's what I always tell. It depends on the individual interest and individual passion and individual goal in life. So based on that, a percentage of students always want to do for the studies like PhD. They go for higher education to foreign countries to do their PhD. And when they become a PhD, most of the time I've seen they fit into the clinical research areas very much. So a lot of clinical research companies tries to hire those PhD in public health. And some of them even have gone into postdoc. After the PhD in public health, they do postdoc in public health and they become professors of reputed public health schools. So there is no limit, no watertight compartment. They're free to do any kind of health ecosystem work with this degree.
Okay. So once there are students who are convinced, okay, all right, I'll do this degree, I want to learn this program, they join, and then there's a time for them to do internships. So since internships are usually for a very short period of time, what are the positions that are offered to interns who are from the public health background?
In fact, I always suggest that students during their pre-internship stage, when they have started their public health course, they have to figure out which track they would like to take based on their interest, their passion, their liking, their personality. They can decide out of the so many tracks I discussed about public health careers, whether it is public health business analyst, public health research, public health management, public health informatics, or public health digital health related jobs, or getting into pharma companies or health and life sciences division analyst, all those, are variety of tracks. And once the students decide which track they like to make their career out of, and accordingly they can decide the internship companies or internship organizations. So what happens is when they do internship in an organization of their career track choice, that becomes a perfect match when they get into the job. And today, all these type of companies, be it pharma companies, be it medical technology companies, be it consulting companies, be it international NGOs in public health, be it the local NGOs or national NGOs in healthcare, be it hospitals, and nonetheless, the national health mission or government programs of each state, all these organizations look forward to interns with MPH students. So there are variety of choice. And even I've seen MPH students are going to companies like Philips Healthcare, GE Healthcare, Siemens, Medtronic, Trivitron. These are all medtech companies of the world. So they also recruit public health students as interns, and those who are interested into such means can make a career after the internship.
Right. And as you were also saying, public health is still quite new here. And it's a program that's slowly spreading across the country. Do you think there is substantial demand for public health professionals um, in the government, non-profit, private, as you've mentioned, the pharma companies? They want a lot of people from this background, but what kind of roles would they be, and how does one decide what sector to choose and what area to go into, whether it be the non-profit or should it be the government? How does one make a decision on that?
Yeah, so that's a very difficult part. And I always tell the students when they decide to join MPH program, I think the first semester, they normally analyze, introspect. In case of any difficulty, they should consult the faculty members, get some advice, get some guidance. They have to take a decision which is of those many tracks they would enjoy the job later, or which is that track which they like, they have a passion for it, and they love to work in that sector. Once that is done, then it becomes very, very easy for them to do their internships and also focus on studies which are related to that track. And that's a very, very critical stage. The students who are not very sure of anything, very, very kind of a confused state and don't know which track to take, becomes very, very difficult to focus on a particular track. But then they take some time post qualification after working for a couple of years. They do realize their passion area, their interest area, and the area which they love to do their career. And then they also kind of find a good track of their choice. And this is what I have been observing not until a couple of years or until maybe pre-COVID or 5, 10 years back. MPH was considered as a very healthcare linked career. But today, the way I am explaining, the technology companies, the hospitals are recruiting public health professionals, because a lot of these hospitals, they do community outreach, mobile health activities, large number. And that is one of the main strategy for hospitals to link with the communities and screening programs. And they also recruit public health professionals to be in hospitals. So public health professionals are required all across the ecosystem of healthcare. The way I spoke, I'm speaking again and again to make you understand that it's not just one type of organization, it's a multitude of organizations in the entire healthcare ecosystem which needs public health professionals and typically masters in public health.
Yes, and I think one major thing that we can all remember is we can change the track as we work with these different sectors as well. We can understand how they work, and okay, if it suits our interests, our future aspirations, we could proceed with them, or we could decide if another sector would be more suitable. But the point that Dr. Pradhan has been making is that your degree would support you whichever track you choose. So that is one thing that help a lot of students make a choice on what is the field that they'd like to continue in. One thing that again I'd like to bring up, which a lot of students are curious about, because it's not very common that you see a lot of job listings for public health. Recently, of course, they've increased, but what would you say is something of an approximate value, like a salary range that students can expect, just to give them an idea?
Okay. So typically, again, from my experience, so what I've observed is the students, when they join any MBA program, they're also from variety of background and variety of experience range. There are students who are very fresh, just completed the graduation and joined MBH, and there are students who come with 2 to 3 years of experience. Some come with 5 years of experience. So there is a varied kind of range of students. So what happens when the placement comes up after 2 years of studies, although all of them studied the same thing in the same classroom, similar degree and everything, when it comes to placement, the employers try to give a higher salary bracket to experienced professionals who have done a couple of years of work and then come for MPH than the freshers. Because healthcare sector as a whole, they love taking experienced people and they value the experience. So hence what happens is, if the fresher MPH offered a salary of, let's say, 4.5 or 5 lakhs as a starting salary, the experienced professionals doing MPH are offered almost 10 lakhs and 12 lakhs starting salary. So that's the kind of range, literally double. And sometimes it's triple also. If and also it has some linkage to need. Let's say there is a MBBS doctor versus a pharmacist versus a nurse versus a BCom or a BA or a BBA coming into the course or a BSc microbiology, BSc some nutrition kind of a background. So the salaries also differ a bit, in the sense, if the starting salary for a fresher without any medical degree is around 5 lakhs, the person with a medical degree would probably get into 12 lakhs. So this kind of variations are there. Although all of them study the same classroom, similar years, similar studies and similar degree, but based on experience and based on the background qualification, the starting salaries would differ. But over a period, with the experience of 5 to 6 years, I think this salary is kind of rationalized, which means there the employer is not considering what background you come from. The employer is considering you as an experienced public health professionals, and salaries are almost equal without any bias towards background.
Yes, and I think that is something that goes across fields. Whatever field you pursue, your experience is what determines your salary at a lot of places. But this is great to know for some students to get an idea about how things are once you do a master's in public health. Um, I would just like to request all participants to mute themselves, since it will be a disturbance otherwise when the speaker is speaking. One last question, where we just sort of draw like a broad picture for public health professionals and their role in the future, especially right now with so many, with the pandemic, a lot of interventions in healthcare, generally a lot of focus on health across the world with climate change. There's health professionals are gaining more importance, but not just in their niche field, like not just in medicines, for instance, but public health as a field is gaining prominence because of its holistic nature, as we've talked about it. So, what do you think the future as we see it today? What is that the role that they'll be playing? And just like a brief conclusion to our session.
So ultimately, all this master's program in healthcare, be it MBA healthcare, be it MPH, be it MHA, those kind of qualifications, the whole objective is to creating a leader of the future. So ultimately, we are aiming at these people as the top management, CEOs, CEOs, the public health leaders, the public health kind of directors, all those. So those are the ultimate position. And if you look at the developed world, you'll be surprised to see all the leadership positions in health sector will have, let's say somebody has a MD, will have MPH for sure. Just a MD is not getting a leadership position in the health sector. Any healthcare ecosystem, be it pharma company, be it medtech company, be it research company, be it hospitals, wherever. So always you will see MD, MPH. And those trends are coming into India and the developing world now. Any medical professional wants to be a leader, wants to be a CEO, wants to be a top management, need to have MPH. Similarly, anybody with a MPH with 15, 20 years of experience will be called for a leadership position in all this pharma research, pharma health systems analyst, digital health companies, the consulting companies in the health verticals. So all these, ultimately, they'll be heading towards a leadership position, appropriate amount of experience.
And that was a very, I think, inspiring answer for anyone who was even considering a degree of the masters in public health. As you can see, there is so much scope. There are so many directions that you can take if you take a degree in MPH, because it complements any background of education, and it's really looking deeply within healthcare from all perspectives.